Hi, it's Lesley, the TheLiaisonRN, here linking you to better health. It's time to shock your surgical team. I am so excited about this next series of videos where I'm going to teach you how to be best prepared for your next surgical procedure. So let's get this started. Of course, you could go to the TheLiaisonRN and see everything here that I'm going to go over. If you like this series of videos, please make sure you like them and subscribe to my YouTube channel so you don't miss any future videos. Okay, let's get started. So first of all, before surgery, we want to have your journal. This is going to be important here. You need to know when to start and stop your medications. You could be on insulin, blood thinners, blood pressure medications, things like that. Your surgeon will instruct you when you need to stop those before surgery, and you also need to know when you're supposed to restart them. Usually it's the next day, but sometimes with blood thinners, they want you to wait a couple days or have you on a different medication. The next thing is to NPO. Nothing by mouth in Latin. So this includes no gum, no hard candy, no chewing tobacco, day of surgery. All those things really increase your saliva in your mouth. That goes into your stomach, and when you go to surgery, they'll be putting a tube in your throat, and that can actually trigger a gag response, which that stomach contents will come back and could get into your lungs. Very dangerous. So make sure you know when you're supposed to stop eating and drinking. Next thing, restrictions. A lot of times weight bearing, exercise, and driving. So if you're having an ortho case, an ACL repair, a lot of times they don't want you to be putting any weight on that at all. However, hip replacements, knee replacements, they want you to get up and start walking. So make sure you know what your restrictions are going to be after surgery. Plan your ride. So this is going to be your responsible person for the first 24 hours after surgery. This needs to be an adult that is able to take care of you. Maybe that adult is unable to pick you up. You can have another friend or family member that can come take you to home and bring you to that person. So you have your ride now. Now you want to prepare all your documentation. In my first video, we went over quite a bit of that, so we won't go over it, but make sure you have your pulse prepared if you're a DNR, which you can be a DNR during a procedure. So you can advocate for yourself for that if you need to. Your power of attorney, and then your med list. This is a big thing. Yes, we can see it in the computer, but what we need to know is when your last dose was when you come to surgery. So what we like you to do is write on a piece of paper or have your computer printout of your MAR, and you write the last time you had that dose, the day of surgery. So if you took your blood pressure medication that morning, we want to know what time you took it at. And then when you bring that to your pre-op, your nurse is going to be so excited because it's right there. It's easy to go over, and then we don't have to do all these other medications that maybe you're not even taking anymore. Okay, so next it's all your equipment. You got to have this before you go to surgery, so when you get home, it's there. So of course, ice packs, lots of ice packs. I prefer the gel ones because they're nice and soft, and then when they melt, if it's ice, it melts, it gets wet. When these melt, they don't really get wet, so you just stick it in the freezer and have another one ready. 20 minutes on, 20 minutes off. I also like the ones with straps so that if you have a joint or something that you need ice, you can really get it compressed on there well to get good cooling around the entire joint. And then of course your physical therapy stuff that you might need. It's nice to have all that ready for you at home. Pillows, have some wedge pillows or just really firm pillows. So if you need to elevate a limb, you have that. Also any equipment such as walkers, canes, crutches, mobility scooters, whatever you need. Again, if you can't afford these things, there are resources out there. So you could just ask your surgical team, your surgeon's office, if there's any connections that you get. Also Goodwill or Salvation Army can help you out as well. Another thing I like to have people do is have some sort of sports drink. So like that they can mix 50-50 with water, because a lot of people get nauseous after surgery. So when you get home, you're not going to feel like eating, but if you just take small sips of this 50-50 mixture, you'll stay hydrated and you'll still get some electrolytes that you need. Facilities have translators provided for you. Sometimes they're not available all the time, and we really need them before surgery and after surgery so that we can translate not just what's going to happen during the procedure, but also after the procedure, so we can communicate if you're having pain or nausea, and also your instructions. So another thing I ask people to do is try to get your prescriptions before surgery. Of course, if you get them filled, you will not get a refill, so don't take them. Yes, so you have knee pain, don't take them. Those are for after surgery. If for some reason or you could just leave them at the pharmacy and then have whoever's waiting for you or picking you up, have them grab them on their way to come get you. And then you can start using your medications as soon as you get home. Another thing I ask people to try to do is go ahead and try to research some alternative therapies. So aromatherapy, acupuncture, meditation, those kind of things are actually pretty effective. And then of course, back to the financial assistance. If you need any sort of financial assistance, please talk to your doctor so that you can get the financial assistance you need. Okay, again, you can go to TheLiaisonRN, but from home, you can just go down here where it's getting prepared, and then here's your emergency prep, surgery prep, documentations, and the questions to ask. And that's it. I'm TheLiaisonRN. Stay tuned for the next video. It's going to tell you all about what to expect day of surgery.